Caregivers often notice changes before anyone else does, not because they are medical experts, but because they know the person so well. So when thinking patterns, stress tolerance, or emotional responses begin to change, caregivers are often the first to recognize that something feels different. Brain injury and neurological conditions frequently begin with subtle changes that are easy for others to miss. Many neurological symptoms are invisible. A person may look physically the same, but experience changes in processing speed, emotional regulation, memory, or mental energy. Because these symptoms are not outwardly obvious, caregivers often feel alone in recognizing that something has changed. One common change after brain injury is reduced stress tolerance. The brain may require more energy to process information, which means situations that were once manageable may become overwhelming more quickly. Noise, multitasking, busy environments, or decision-making can create fatigue faster than expected. Cognitive fatigue is different from normal tiredness. The brain may be working harder to complete everyday tasks. Even when someone appears fine externally, they may feel mentally exhausted much sooner. This fatigue can affect patience, concentration, and emotional regulation. Caregivers often notice changes in emotional responses. This may include increased irritability, reduced patience, or feeling overwhelmed more easily. These changes are often related to neurological network function rather than intentional behavior. This can be confusing for families, especially when the person was previously calm or highly organized. Many caregivers find themselves becoming constantly alert, monitoring situations, anticipating triggers, adjusting environments, and trying to prevent overwhelm can be part of our daily life. This ongoing awareness can place strain on the caregiver's own nervous system over time. Caregiving often includes many responsibilities that others do not see, from managing appointments, medication, emotional support, environmental adjustments, and daily decision-making can require significant mental energy. Much of this work happens quietly in the background. Research consistently shows increased stress and emotional strain among caregivers of individuals with neurological conditions. The responsibility levels can be high, and many caregivers feel pressure to remain steady, even during difficult periods. Neurological symptoms often fluctuate. Some days may appear relatively typical. Other days may be more difficult. This variability can make planning and expectations challenging for both caregivers and families. Because caregiving often involves long periods of heightened alertness, some caregivers explore ways to support their own nervous system regulation. This can include structured routines, pacing strategies, breathing techniques, or sensory tools designed to promote relaxation. If you are noticing changes that feel difficult to explain, you are not alone. Many caregivers describe similar experiences when neurological function changes. Access to clear information and supportive resources can help families better understand what they are experiencing. Thank you for joining me. I'm Heather Robbins with Robbins Nest Alliance.